That's why I told you this month we are in Bomet. Last month we were in Oyuges. We are going to different regions. We operate in 5 counties. In Uasin Gishu, Bomet, Kisumu, Nairobi, and Mombasa, and environs. So our main intention is to go to the grassroots where most of these poor patients come to Nairobi and they don't have a place to stay because they're out in the village. So this information need to reach them, need to work in with the chiefs.
Actually, Diana, what you're saying is most patients ask us, and even when they attend support groups and they take our numbers, they really call us. Perhaps patients are in up country and they keep asking, you people do those support groups only in Nairobi. Why don't you do grassroots things so that we can benefit from here? It's often not easy, Diana, for patients to travel. You may find it's a single mother, perhaps with 5 children. Coming to Nairobi is difficult, raising the transport. The children might be young, or not just a single. Patients often experience a lot of difficulty traveling to Nairobi because of the financial reasons, raising transport, lack of a place to stay. So I really support you on that. A program which can involve, which will do grassroots activities, for me is a high welcome.
Yeah, that's wonderful. So we are going to have meetings and we will chat. I'm coming to Kenya in April briefly. Hopefully I'm going to create some time to meet with you, and we will be in Kenya in July for the main event. Hopefully we will work with your organization and what you do to be able to bring in more cancer patients and survivors on board. But before you leave, do you want to share with us what your organization does so that anybody that would love to link up with you can know about what you do?
Yes, thank you so much for that opportunity. As I mentioned, our organization is called Beth Rafa Cancer Foundation. So Beth Rafa is spelled BETH hyphen, then Rafa, RAPHA. This name, we decided to get it. It means a place of healing. So we decided to call it like that. So in a nutshell, what we do is we support patients with a place to stay, patients who have no place to stay. We have rented a house near KNH, Kenyatta National Hospital. So patients who come from up country and lack a place to stay, we give them a place to stay for free. We don't charge them. And we support them with food stuff. So we give them at least good food for the entire period of their stay so they can get good nutrition, especially chemotherapy patients and radio who are undergoing treatment often need good nutrition. So that's what we do. People which can link up and we together support these patients. And lastly, we also do visitation to patients' homes. We identify the very needy patients and we take them some food stuff as we get along the way, just to support them, those who are on treatment. So basically, that's what we do, Diana.
That's very good, because that's also what we do with my organization in Kenya. So when you talk about healthy food, what foods do you take to them?
We try to take to them dry grains like rice, beans, and some fruits from the market.
Okay.
Mostly that's what
rice.
we do.
I hope you don't do white rice for them. Make sure it's brown.
Brown, yeah, whole meal.
Yeah, the whole meal. Yeah. Okay. Wow, that's really good. We are going to talk about what we can do to support each other. I don't know if you have a website. If you do, we can have you, a route to your website on our website, and we can have your logo on our website. For me, it's about supporting, as long as it's something that genuinely helps cancer patients. I am in there. I am in there to support in whichever way I'm able to. And if we are to partner to get to the grassroots, if we are to do some activities together, we will do that. We will do that. And he bring Fatu up. Fatu has a question. Look at Fatu, I told you, we are normally cancer patients. Fatu is now in the hospital. And whenever there is Fatu is always running to help patients. Fatu, I did not know they took you back.
I'm not going to talk about me. Let me talk to Wilson first.
Yes, talk to Wilson, my
Wilson,
Okay.
sister.
Wilson, okay, I want to know about the women that you helping. How are they doing with their sanitation, especially those seeing their periods? You understand? Are they
Mhm.
having good sanitations? Like, are they having frequent change of pads? Because that would also cause more infection to them. So, is that part of your program or not? And if not, can you add that in your program?
Is it like the cervical cancer patients or all women with cancer?
No, yeah, all women with cancer. You know, sometimes because of poverty, we don't use pads. We use it and it's full, and we still continue using and stuff like that. So please, is that part of your program? And what can we do to make sure those people have that?
Oh,
Wilson,
thank
maybe
you.
generally about sanitation. Do you train them on the importance of, cleanliness and help to provide, especially for those that you provide housing for? Do you,
Infection, cancer
check on
goes with
that? Yeah.
infection. So cancer goes with infection.
Yes.
And when there is too much infection, the cancer healing is gonna be very tough.
Okay. All right. Let's listen to Wilson then.
Yeah, okay. Thank you so much, Fatu. Good to hear from you. And by the way, we wish you well. We wish you good health and strength. Um, just to respond quickly on Fatu's concern is it is true here in Kenya, and I know generally in Africa, in the few countries I know of, there's because of poverty and people who come from low income areas often experience lack adequate resources to buy sanitary pads. So, but God has been faithful. We've found some few well wishers who support us with sanitary pads. And I think it's okay to mention a few. We have a group of saloonists from Nairobi. They have an organization that is called Wigs and Wings. So they support us with,
Diana. Her name is Diana.
one of them is Diana. Yes, one of them is Diana. Diana actually knows me. We work together, though
Okay.
Diana does mostly the wigs. But there's
Yes.
another group that does what we call wings. By wings, it's a name they've given for sanitary pads. So they
Oh,
always support us. It's called Wigs and Wings. It's an association of saloonists and hairstylists in Nairobi. So they do support me, and I'm able to give to needy patients. So to be honest, we have not lacked that because at least we have diapers, we have sanitary pads for the ladies. So, but previously it was a problem, as Fatu points out, it was a problem, it was inadequate, but at least awareness has come, and there's a lot of support coming in and a lot of training, especially during the support groups. We bring nurses who train them a lot on hygiene on that.
wonderful, wonderful. Thank you so much. I brought do this other two my thrivers here, so they ask you one question. So I'll start with Tracy. Tracy's in the UK. She's a breast cancer thriver. Tracy, I brought you up to ask a question. I know there must be a question in your mind.
Now, well, the question I'd ask is, what do these patients who can't have these PET scans do? I know you talked about it, but what is the other alternative when they can't get the tests at all? Because I'm so shocked. There's only two in the country. I thought you meant two in Nairobi.
In the country.
In the country. So what do other people like patients from Mombasa, patients from all across? What's the alternative? Is there ever
That-
an alternative?
Yeah, unfortunately, we only have those two. We only have Aga Khan, which is private, and we have Kenyatta University Teaching and Referral Hospital, which is public. So often these facilities are overwhelmed, to be honest. But I have made friends with the PET scan team at KU. At least they're able to prioritize the very severe and needy cases, and often they do help. Unfortunately, it's overwhelmed, as I mentioned.
Oh, I just saw what Fatu said. Fatu said our country doesn't have one at all.
Gambia does not even have one.
Right.
Oh my God.
That's
But
what I'm
then,
telling you.
so what
It's so
shocked me
important.
is,
You see the need. You never know. One day, maybe cancer thrivers will just come together and provide one for the Gambia.
I
Add some
know.
for Mombasa and
Yeah.
Kisumu and Western Kakamega and Central. Because now there is no alternative, Tracy. They have to travel. Someone has to catch a bus or a train from Mombasa to
Yeah.
come and put their name on the list as they wait for 3 months to get the PET scan.
On top of the
That's
pain, on top of the suffering.
yeah,
That's
yeah. That's
awful.
what happens. Yeah, it's so
And
sad.
even the one in Kenyatta is still quite recent. The one in the public hospital, it was actually one in the entire country. The one in Kenyatta is only a year old. So previously it was only one.
Yeah, that's a
So
dire
why can't
situation.
why can't the government do something? I'm sure there's people out there who are able to
Yeah,
do something about it.
prioritization, and that's why I'm saying it's all about stigma. It's the stigma around cancer. You know, many times they look at cancer the way it was looked at before. Like, so even if we do this, these people will not survive. You know, it's the mentality. I told you one time I was in a meeting with a governor, I won't say, and his minister for health was there. And this minister wasn't even embarrassed to talk about leukemia patients. They say, leukemia, they can't live. They can't even go past 1 year. Yet I have my own friend who is over 3 years past leukemia. I had to look at her and say, that's not true. And she said, oh, the friend you're talking about is in America. I said, no, my friend is in Kisii. My friend is in Kisii. So they've already formed in their mind that these ones, no, nothing can be done. So we should not prioritize funds in that area. Let's take funds to maybe HIV. Let's take funds to some other things and not cancer. And that is stigma. So there is a lot of stigma around that they just need to change their perspective. You know, when they see us coming and being in the front line, doing this, creating awareness and telling them, look, there is need. We in these other countries, we are thriving and moving, and this is what we want our people also to go through. We want our people to have that breath of fresh air. Even if they will have it for 5 years or 10 years or 20, they will have that quality of life. And that is what everybody wishes for. You know, dollar bills. Question for Mr. Wilson.
Hi, Mr. Wilson. Thanks for all you're doing.
Welcome.
Great to have you here. But I don't know if you spoke about it. Maybe I wasn't here, but I asked the question, do you do counseling to patients before breaking the bad news? Because there was a guy here who his dad had cancer. And then the doctor told the dad that, oh, you have cancer and it spread everywhere. So just like that, yani hivyo tu kumtupia, I don't know, is there a way, is there counseling before you break the bad news?
Yeah, thank you for that question. Previously, it was very limited. And actually, how I got to go to KNH Diana is a research was done by American Cancer Society, and this was identified as one of the gaps. And we were hired and trained by American Cancer Society to come and fill this gap. So previously it was not there. Actually, when you hear stories of patients, even during the support groups, it is horrifying how the news was carelessly broken to them. But nowadays, with the program called the Patient Navigation Program, at least we cancel them fast. We cancel them fast before we break the news. Unfortunately, as I mentioned, this program is only in Kenyatta National Hospital, the navigation, and it's the only one in the entire Africa. So we still have a gap. The counseling is still minimal in other public hospitals. I don't know much about private, but I know there's still some gap in that area. So still there's a problem in that.
Yeah. And dollar bills, I know dollar bills has had interest in the housing of patients. And I will be inviting her in some of the meetings we'll be having, because that has been her cry. We had to take, there's a patient we had that we had even to take to a place where we were told it was a hospice. And when we went there, the patient did not even last. We came out the following day. It was an Airbnb. When the patient was in pain in the night and asking, okay, so now where is the doctor? Where doctors come? Oh, you have to pay extra money for doctor to come. You know, and that is a big need. I don't know. I don't think, you said you worked for a hospice before. I don't know if there is really great hospices in Nairobi, in Kenya.
Is it really hospice, or it's just a name? Like, I don't understand if they have like
A
hospices.
bad experience.
I don't know.
There are a few hospices in Nairobi. I know there is one which is run by a missionary group, I think Catholic. And KNH is next to Nairobi Hospice. Unfortunately, they don't do inpatient. They see patients on outpatient basis. There's one I
So they
worked
go to
for.
their homes.
Yeah. There's one I worked for in Wasingishu County. It's called Kimbilio Hospice. I worked with them for like 4 years. They used to have inpatient, and the services were quite excellent. It was run by an American group called Living Room International.
Wow. Is it still there?
Yeah, it's still there. I think they run 2 hospices, one in a place called Kipkaren in Wasingishu, and there's another one near Eldoret town. So I think they run 2 hospices, which are quite good, excellent.
Wonderful. You'll give us some details. We can hook up our team in Eldoret with them. But it is our wish, Dollar Bills and I know she has it in her heart, the hospices and also accommodation for patients. And when we meet with you, we get to know you more. There will be no need of duplicating your services. You never know. She may come in and just help grow whatever you've already provided, but we'll have to see, and people like Doreen will come and visit and see, so that we see where we can come in when there are patients coming from up country that need a place to stay. So those are things that we can do together. So I know it's
Regards to housing, there is sorry for that, Diana, but just a quick one. Yeah, regards to housing, I think there are 2 places that offer housing near KNH. Unfortunately, they charge, and most patients can't afford. So that informed us beginning one with some 2 friends, so that we don't charge, so that we assist, because if we charge, there are many who can't afford. So we support them for free entirely.
That's true. That's true. Yeah. Thank you so much. May God bless what you do, and may God continue to use us. I normally say every time, it's not everybody that has the same heart. It's normally very few people. And when those few people come and get to know each other, they do even greater. And so I know that this is just a beginning. I know that God has added us years, has added me, has added Dollar Bills, has added Tracy, and some others of us, has added us this so that we come in and put our heads together and see where we can come in to help our people. They say east or west, home is best. It's normally not home is best as in you have to be home. No, home is best in that if you have sojourned and gone to that other land, are you helping or looking back at your motherland? When the Israelites were taken into captivity, they were still thinking of their place. They were with this other king, but they're thinking of the temples in their place, the broken ruins and everything. So I know that especially the housing, it has really, really stressed us when we see the way patients don't have a place to go. And so I know we will be talking much and we will be doing much. So thank you guys so much. Take care and have a good night. God bless you and thank you. Bye.
Thank you so much. God bless you. Bye. It was good to see all of you, and best wishes to the plans you have ahead of you. May God use you. May you continue being a blessing to the patients, thrivers. And thank you so much. We look forward to working together. Have a good day.
All right.